Morgan with iHealth 2. We're visiting with Dr. Cheryl Selman. We've talked a little bit about hysterectomies and how so many of them are unnecessary. Could you talk about the causes and some of the things that we could do to avoid hysterectomies?
Yes, I'd be delighted to, because we really want to, if at all possible, prevent a woman from giving up her uterus.
Mm-hmm.
So the number one reason for hysterectomies is due to fibroids. Now, fibroids are benign growths in the uterus. What fuels fibroids is estrogen. So first of all, if we're showing signs of fibroids, we really want to address it as soon as possible, because the bigger the fibroid becomes, the more difficult it is to reverse this trend or eliminate it, because large fibroids actually start producing their own estrogen. So we want to get it early.
So a fibroid, how would we know that we had a fibroid?
Well, when they are small, we don't really know unless we go to a doctor or they do some tests to show us that there's some, signs of fibroids. But as they get bigger, they can apply more pressure.
Mm-hmm.
We can either feel pressure, or we can be urinating more frequently, or one of the common symptoms is we have heavy bleeding.
Okay.
Heavy bleeding is often associated with the growth of fibroids.
Okay.
So fibroids are benign tumors stimulated by too much estrogen.
Estrogen.
Because estrogen proliferates cell growth. So it will stimulate estrogen-sensitive tissue, and that is found in the uterus. It's found in the breasts, found in the ovaries, but certainly found in the uterus. So if we suspect we're getting fibroids, or if we suspect we're estrogen dominant, and basically PMS, symptoms of PMS are signs of estrogen dominance.
Really?
Yes.
Okay.
Yes. Because, well, we can talk about that.
Sure.
We can talk about we can talk about a future time. Let's stick with the fibroids and the hysterectomies. So we want to get on top of fibroids. And what are some of the things we need to do? Well, we need to create more hormonal balance, and that really requires bringing more progesterone into the system, because we're
talked about that, yes, in your book.
So we need to get more progesterone. We can use some natural progesterone cream, which is a great way to help support that balance.
Mm-hmm.
But we need to do other things in addition to that. We need to support liver function, because without proper liver function, the liver can metabolize estrogen into a more toxic form. So we need to make sure we are reducing the things that create toxic liver, such as trying to eat organically, reduce alcohol, caffeine, smoking, all those things that are known to compromise liver function.
So these lifestyle changes that you make, it's because of liver function.
That's right. Very important. You need to really support a healthy liver. We also need to be balancing blood sugar levels. We don't think about this, but when we are upsetting our blood sugar levels, and by that I mean we're eating too much sugar, or we're eating foods such as bagels and Cinnabons and lollipops and sodas, whether it's the sugar itself or the refined carbohydrates, they all turn into sugar immediately. And why is that related to hormones? Because when you have high insulin levels, you actually will be stimulating high estrogen levels.
So then it could contribute to diabetes, which is another whole topic, right?
And obesity and being overweight, absolutely. So we need to balance blood sugar levels. What I have found that works really well in helping with fibroids is to work with liver support nutrients. We need to be providing the body with the minerals that help balance blood sugar levels, such as chromium. But I find that most of us are very deficient in key minerals such as magnesium and zinc and selenium, so we need a good multi-mineral. We need to be supporting a thyroid. Generally, most of these issues like fibroids and endometriosis and infertility and PMS have a thyroid component. So we really want to check the thyroid and support the thyroid. And we can support the thyroid by giving it more iodine, by providing it with selenium, magnesium, vitamin A. These are nutrients for the thyroid. The other thing is a practical thing we can do is use a castor oil pack. Castor oil packs.
Really?
Yes, castor oil packs. Castor oil is has renowned healing
Yes.
abilities. And castor oil pack is a very simple thing to do because you just take what we call flannels. So there's the fabric you can get. It's a cotton flannel. You usually use it in 3 layers. Soak it with the castor oil. Put it on your abdominal area and apply heat. So it's kind of sticky castor oil, so you want to put like a plastic wrap over it and put a heating pad on top of it for about an hour. Castor oil supports lymph detoxification. It moves the lymph. It helps to increase circulation, and it basically will support the blood supply to this area so it can take out the toxins and bring in healthy nutrients. That's really important. And there's one other thing that I found really, really good for fibroids.
All right.
And that's nutritional support called systemic enzymes or proteolytic enzymes. Now, these are protein digesting enzymes. And why I recommend them for women with fibroids is, and you take them away from food, so you don't take them with foods. Take them away from foods. Proteolytic enzymes have the ability to dissolve fibrotic material. So the fibroid tumor is, kind of dead tissue. And proteolytic enzymes go in and actually dissolve these fibroid growths. So you can help eliminate the fibroids in that way. So there's a range of things women can do. What you want to do is get onto it immediately, make lifestyle changes. We have to reduce stress because stress will always create an estrogen excess condition. And then take proper nutritional support and use some of these other techniques like castor oil pack. If you get really proactive, you get committed, if you really go for it 100%, you actually can stop the growth of fibroids, and in some cases you can actually reverse fibroids and go a long way to saving yourself from a hysterectomy.
Well, that's very promising advice. Thank you, Dr. Selman.
You're welcome.